Welcome back to the Girlfriend Doctor Show. It is good to be here with you today, and especially as we're going to talk about one of my favorite topics, and that is on hormone disruption. It is not a happy topic to talk about, but it is a eye-opening and empowering topic to talk about. We want to today provide you with information to help you recognize where there is some interference in your body's natural hormonal production. What could be going on? Certainly, the topic of hormone disruptors and toxins is not sexy, but I guarantee you are going to love this episode. We're also going to talk about post-COVID, whether you've had it or been vaccinated against it, what type of hormonal changes have been happening and what physicians in the field, right, boots to the ground, are actually seeing. So this will probably be very valuable information that you will not hear anywhere else. So I want you to grab a pen and paper, take notes, and be ready to listen, be ready to absorb this information, because I'm excited to share it with you and share with you my guest expert today, someone that I have admired for many years. I first heard her lecture over a decade ago at an Institute of Functional Medicine conference, and she is a fellow OBGYN, which, again, very rare in the space of longevity medicine, integrative medicine, and functional medicine. So really important to hear from her and her expertise. But her journey, her own personal journey and her own clinical journey has taken her on quite a path to dig deep into these environmental toxins, into psychoneurotropics, into the effect of hormones on our emotional well-being, and so much more. So today I introduce you to Dr. Margaret Christensen. She has been in functional medicine for 15 years. She is the owner and founder of a very boutique functional medicine practice known as Cabeca Collaborative, which is a large multidisciplinary practice in Dallas. And I will be collaborating with them starting in August. So I'm excited to be seeing clients again and to be among these greats in this area. She is, again, just a inspiration. What I love about her collaborative is that it is exactly that. From chiropractors, nurse practitioners, other healthcare providers, coaches, nutritionists, mental health and mental support. There is so much that's there. Plus, she has a yoga studio. And when I was there just yesterday, there was a sound meditation going on. So I was able to enjoy a sound meditation. And she has a kitchen that I'll be doing some cooking classes from. I can't wait. But without further ado, let me introduce you to Dr. Margaret Christensen. Welcome, Margaret.
Hi there, Anna. So great to be here, and thank you for the invitation to chat. And yeah, we're real excited for you to be here with us. And it's 22 years in functional medicine. I need to update that.
You have been in 22.
The bio, and I've been teaching integrative women's hormones for a long period of time. And yeah, so yeah, we're there's lots of different pieces here. And I'm just a huge advocate for helping to understand, like you are, why are we seeing the hormonal disruptions that we're seeing, the infertility issues and the severe PMS and the PCOS and all that. And so just really
severe menopausal symptoms, right?
Menopausal symptoms,
bleeding disruption, spikes in cancers. I mean, This is like no other time I've only been in practice for over 35 years, only been in medicine, over 35 years. But like you, I mean, tell a little bit about your story, how you went from standard OBGYN to what you're doing today. A little bit of your personal story.
Yeah, sure. I probably never was a standard OB-GYN to begin with. I was highly influenced by the midwifery model to begin with, and understanding that women's bodies are powerful and we're designed to give birth, and that you and I are trained is that birth is disaster until proven otherwise. The midwifery model means with woman. And, when you tell women, gosh, your bodies are strong, they're powerful, great spirit source, God designed you this way. And you learn how to tap into that power. That's how I started. And I ran big obstetrics practice for 10 years. I was doing OB and Gen, and then I got sick. I also had nurse midwives working with me, and I was doing some out of hospital births as well. But I got to the point where I got so fatigued, I couldn't figure out what was wrong with me. I was having such severe fibromyalgia and pain that despite the fact I was so severe fatigued, I couldn't sleep. And it was so bad, and my brain wasn't working. I was having such terrible brain fog. I couldn't even think. It took me 30 minutes to take a shower because I couldn't think of what the next step was. That I closed my practice. I closed, and I thought, okay, well, I'm just, I've had 4 kids. I haven't slept for 16 years. That's a piece. And it's a relatively high stress field to begin with. So I'm like, okay. And then I went around from doctor to doctor, all my colleagues who were so wonderful. And they just said, oh, honey, you're just depressed. You're just depressed. Here's your antidepressants. Here's your pain medicines. Go see the physical therapist. Well, 2 years later, I'm not working. I still can't sleep. I still feel like shit. Excuse me. I still feel terrible. And and so somebody handed me some vitamins one day, and I was kind of rolled my eyeballs and said, oh yeah, expensive urine. But I took them anyway. And then 3 months later, I'm like, man, I feel a whole lot better. And then I quit taking them because I thought, oh, I don't need these anymore. And then I crashed, and I'm like, oh, okay, something's here. Clearly, I was getting something that I was missing. Now, I still didn't know what the underlying cause was, but I just, I got in that. And then I fell into functional medicine through another one of my teachers and mentors. Her name is Bethany Hayes. She was with Christian Northrup and at Women to Women, and also Marcel Pick. But Bethany's
love them.
Yeah. So all dear to my heart. Bethany said, hey, why don't you look at this functional medicine? And also at the same time, my son, who's now 31, was pretty sick, and or he was starting to have hallucinations. And anyway, so I got into functional medicine, and just by changing diet and taking some nutrients, I turned my symptoms around. 8 years later, I had restarted a little tiny practice. I was literally in a the size of a shoebox office, like 500 square feet, just me and just chatting and doing women's hormones. I got sick again, and the same thing happened. And I went to the environmental health center at that point and found out I had one of the highest levels of toxic mold that the doc had seen there. And I knew nothing about it, but then I got into it, and I really learned. And I learned why everybody in the family was sick, and why 2 of my 4 children still have ongoing issues from unresolved. That those were never addressed. By the time I learned, they were already too old, old enough for that they didn't care to hear what I had to say. So anyway, that's how I got here. And then also my second husband had Parkinson's, and then we took him on a journey. By that time I was working for functional medicine at the Institute for Functional Medicine. I knew everybody in the realm, and just going around everywhere to learn and to understand neurology. And
Dr. Catherine Wilner, right?
Yeah, Catherine Wilner. Yeah, so Catherine Wilner. So she was up there, and then that's when I learned about Lyme, and again, even more in depth about toxic mold and other environmental toxicants, and then understanding, out of all of that, why I was seeing all the issues that I was seeing back when I was doing regular OBGYN that I didn't know were underlying so much of what we were seeing, from infertility to endometriosis to heavy bleeding, PCOS, fibroids, endometriosis, menopause, and also the psychiatric issues that go along with that. So anyway, so that's how I'm here. I started out, this is a calling. God said, do this.
Yeah.
Yeah. I just started little tiny, and if you build it, they will come. So that's what happened.
Yeah, well, I'm so glad you're doing it. And it really is an example to have integrative interdisciplinary practices, because you can, it's a collaboration, and there's so many pieces to our human puzzle and our spiritual puzzle, but there's so many pieces, Margaret. So let's talk specifically about, I want to just jump right in, taking all the risks to talk about this, but to talk about what has happened, what you've seen, and what, the literature is showing too, in post-COVID vaccine hormone disruption. I get so many, I'm seeing clients come out with more pain than ever, exacerbation of symptoms, crazy crashing fatigue and bleeding disorders and spike in
Wow. Well,
unusual
yeah.
cervical
Yeah.
cancers. Yeah.
Yeah. Yeah. I'd love to answer that questions. Let me frame it though first in the kind of in the big picture framework
Yeah.
of again how our hormones produced and utilized and metabolized in our bodies, and then where those disruptions are coming when we're seeing all these endocrine disruptors, these chemicals. So, first we have to understand that, for example, estrogen and progesterone and testosterone are produced mostly in our ovaries. Testosterone, to some extent, can be produced from DHEA, which comes from our adrenal glands. But the signals for all of that to happen start in our brain, in our hypothalamus. So, anything that's affecting and impacting brain function is going to impact everybody's hormones. All of our hormones are metabolized and through our livers and then into our gastrointestinal tract. So if you have a high toxic burden and your liver is not functionally appropriately and is not detoxifying as well as it could, or you have a high genetic need for certain nutrients to make the liver be able to metabolize your hormones, then that can be an issue. Of course, we know that the gut is a huge place. All of your hormones are metabolized and excreted by the good guy bacteria and out of you if your gut's working well. So if you are having IBS, constipation, diarrhea issues, a lot of gas and bloating, small intestinal bacterial overgrowth called SIBO, SIFO is small intestinal fungal overgrowth. All of those things can disrupt how your hormones are being produced and metabolized and utilized in your body. And we know that.
So let me pause on that just to explain how important the gut microbiome or the gut bacteria are to hormone metabolism, production, detoxification.
Yeah.
Because that we talk about it, but I think you can explain it better than me.
Well, it's huge. And then, if you've been for example, let's say living someplace that's in a moldy environment and you're sick all the time, your kids are having ear infections, or you're having sinus infections, or strep throat, or you're having recurrent UTI infections, and you're being taken a lot of antibiotics. Well, antibiotics themselves are disrupting the good guy microbiome and shifting you into having unhealthy bacteria that produce an enzyme. It's called beta-glucuronidase, that ends up recirculating your estrogen. So you end up getting estrogen dominance if you've been on lots of antibiotics over time. That impacts your risk for breast cancer, for uterine cancer, against for heavy bleeding, for infertility issues, for getting uterine fibroids. So the gut microbiome is incredibly important. And I think one of the most important things that we can do is eat organic. And we can get into that because that's probably one of the biggest influencers that's been on our gut. So we have gut and liver issues. Then you have, again, understanding how the gut is also connected to the brain. So I mentioned that everything kind of starts up here in the hypothalamus and then goes to the pituitary gland, and the pituitary gland sends signals to the ovaries or adrenal glands. And so if you've got a lot of gut disruption, we have the vagus nerve, which is the largest nerve in the body, that's sending signals up to the brain that says, uh-oh, something bad's going on here. And I'm stressed, I'm distressed, I'm sad, I'm anxious, I'm upset. And it's coming from the dysbiosis, the unhealthy bacteria in the gut are sending the signals through the vagus nerve up to the brain. That's a very simplified way of looking at it. So those are common ways that endocrine disruptors and chemicals, we'll talk about those in a second, can impact it. You also have toxins that are hormonal mimickers. So they look like a molecule of estrogen or progesterone or testosterone or thyroid, or they have a piece of them, it fits into the key or the receptor on the cells for those. So for example, a lot of plastics and a lot of petroleum byproducts have the same type of chemical structure that estrogen does. And so if you are exposed to lots of plastics and styrofoam and drinking out of plastic water bottles all the time, and and eating foods that have been microwaved in plastics, you're getting a nice little dose of mimickers. Toxic mold is another example. There's a very common mold that will pick a toxin mold, mycotoxin we pick up. It's called zearalenone, which we know from animal studies causes miscarriages, infertility issues, and all kinds of problems there. And it mimics and looks like estrogens. DON, which is one of the really toxic forms, can disrupt testosterone. So,
well, I want to add on that because I write about zearalenone in chapter 6 of the Hormone Fix. Is that in Europe only like a 1/1000th level that is allowable where compared to the United States.
Yeah.
So like our standards for clearing out these hormone disruptors from our food chain are very, very low, very low.
It's frankly, it's a crime. So I mean, so those are the, I think, those are the common ways that we see, and then just stress. So just the amount of stress somebody is under. So, and again, whether that's emotional stress, physical stressors, trauma, and we can certainly speak more to trauma in a minute, but then you're sending signals again up to your brain, to your hypothalamus, run, fight, or freeze, fight, flight, or freeze. That's the limbic system in the brain, has the hypothalamus, the amygdala, and the hippocampus. Those are all parts of the limbic system. And the hypothalamus is the master regulator of everything hormonal. When am I supposed to eat, sleep, wake, take a poop, have sex? That's controlled with the hypothalamus. Then the amygdala is always scanning your environment. Is there going to be a tiger jumping out at me? And the hippocampus is the memory center of the brain. So all those three things are lumped together in that limbic area. If you're under chronic stress all the time, whether it's one big traumatic stress, or chronic daily, every day, being in COVID for 2.5, 3 years, not being able to do the things that we were normally able to do to de-stress, and being fed fear, only one solution. That in itself triggers the limbic system to stay in overdrive, stay in chronic fight or flight. And then when you have high levels of cortisol all the time and high levels of adrenaline is the one that raises your blood pressure and causes the heart racing and that feeling of agitation and nervousness. Cortisol is the one that says, oh man, I think I just need to eat an entire bucket of ice cream and go down some carbs and down a bottle of wine. That's the cortisol response, and puts weight on you, and then disrupts your thyroid function. It disrupts your estrogen production. You make more estrogen relative to natural progesterone, so you get heavy bleeding. So the level of stress and how your body manages stress and what tools you have are critically also important to again, this whole hormonal regulation. So those areas of do you have all the right ingredients for hormonal production in the first place? Do you have everything that you need there? How is your body metabolizing and discarding once it's been used up? And so that, again, that's your detox pathways. Most of your liver and your gut, but your kidneys also play a big role. As is your skin. If you got acne, that's telling you something. Your body is toxic and it's coming out this way. Mm-hmm. Some of us have genetic predispositions. So our detoxing strategies of liver and gut health is important. And then figuring out how are we managing the stress, and how is our HPA axis working? The hypothalamic, pituitary, adrenal axis, but it's also gut, gonads. There's more pieces to that HPA axis than we were trained with.
I know. Yeah. HPATG axis, right? Like it keeps going.
Hypothalamus, pituitary, adrenal, thyroid,
gonadal,
immune, gonadal, gut.
Yeah, exactly. So every piece, it's all related, right?
It's
and of course,
it's all connected.
And the spiritual piece is a significant part about that. I love the picture. For those of you who are watching, if you're not able to see this, come to my YouTube channel at The Girlfriend Doctor. You'll see a drawing by Alex Gray. Alex Gray's father was the author of Gray's Gray's Anatomy, which depicted all our, great anatomical drawings that we use in med school, and that is still like a gold standard. Alex, his son, and Margaret, you can correct me if I'm wrong,
Yeah.
but is very visual into the energetic representation of the human form. So beyond the physical, there's the energetic, and that's the spiritual, the energy centers, the connection. Just amazing.
Yeah, yeah, and again, that's like a whole area that in our Western conventional training we have zero training in, or it really even acknowledgement almost. But if you look at what I like about this picture is that you're depicting both the Chinese medicine, or the Asian medicine of all of the acupuncture meridians, et cetera, along with Ayurvedic medicine, which is 5,000 years old, comes out of India and talks about chakras and energy centers. And of course, probably both of our mentors in that arena was Christian Northrup and Louise Hay. Understanding that we are energy. We're a spiritual being. This is my belief system. We're spiritual beings in a human form. And we are here for a purpose and a reason and meaning, and being able to tap into that and understanding when we have blocks in our spiritual energy. If you have a block here at the fifth chakra, that you're going to have thyroid issues. If you have a block in your second chakra in your pelvis, which is all about family, intimacy, relationships, and creativity, then you can get big old fibroids and endometriosis and other things. And so when I find that in somebody's history, then I'll ask them, what's going on in your relationships? Are you, with your family, with your kids, with your husband? Again, what about histories of abuse? All of that, because that gets blocked. Those energies get blocked in the pelvis a lot.
And I would say, and you can tell me if you've seen the same thing, but I definitely look at menopause as that, is that where you can open Pandora's box. Progesterone drops, and I always call progesterone the lid to our pressure cooker of our life, that neuroprotective hormone. It drops, and this is the opportunity to work through all of that, to release all of that, and to heal from it once and for all. And that, again, opening the energetic flow so they're not trapped in an organ and area of our body causing us problems.
Absolutely. And again, this is Chris Northrup's work, but this was so helpful when I learned this, that oftentimes when we are young kids, that whatever's going on in our lives, if there is dysfunction or abuse or things that we can't speak up or talk about, we can't run or fight. Because we're just a kid. We can't leave our family systems, or we're witnessing, or even going, you go off to school and there's a school shooting there, right? There's not a way to process and to talk about and get it out of you, but that energy is still in you. It gets into your body, and then it just goes underground. And so, then around the time that you start your periods, what we call menarche, your hormones are kind of floating around like this, and then you settle down into this nice rhythm, and then all of a sudden you hit perimenopause and you start doing this again. Well, all the stuff that was buried back here, all the emotions, all of the things that you did not have the ability, the tools to speak about, then resurface at this end of life when your hormones are doing this, because what's it doing? Your hippocampus, your memory center, is loaded with estrogen progesterone receptors. So your hormones are doing like this, going like crazy, and you're pinging stuff, and somebody says something to you and you snap them, you have no idea where that came from. That came from something back here that got triggered here. And so we see that all the time. And so a lot of issues, just like you're saying, this is the opportunity for us to deal with stuff that may have been buried. And again, a lot of memories of abuse surface right around this time too.
Yeah, that's so true. So then the most common hormone disruptions that you're seeing right now come from where? Besides trauma and stress.
Okay. And besides trauma and stress, I would say, again, the environmental toxins. So our food supply and genetically modified foods, I would highly recommend people go to responsibletechnology.org and just start learning what it means that something is genetically modified, and how much Roundup we are all consuming, and not just Roundup, all the other pesticides, and they are all hormonal disruptors, they're neurological disruptors, they're immune system disruptors. And so right there, that's a big one. And I would say the second thing is vaccines. Yeah, and particularly the one that was supposed to be the panacea and cure all for yeah, for this
pandemic,
virus, which is not a novel virus.
Yeah.
And yeah, I probably have to be mindful about what I say.
So we don't get me banned.
Yeah. So,
but this is definitely a medical condition we're seeing, and we're seeing a clear timeline and exacerbation. And you're not new in medicine. You're not straight out of med school dealing like, oh, this is normal. Right. Being people telling patients that it's normal. It is absolutely not normal.
It's not normal. And what I can say, let's just call it long haul COVID. And long haul COVID is coming from the spike. I've been treating long haul COVID for 22 years. I mean, I've been doing this for a long time. So this is not new. All this chronic fatigue, the fibromyalgia, the brain fog, the gut issues that we're seeing, again, the fibromyalgia pieces that we're seeing, the brain fog things that we're seeing, the immune system disruption, the autoimmunity that we're seeing, the cancers that we're seeing, all of this this has been going on for years and years. This is what I've been treating. It caused by not just viruses, by environmental toxins. Go ahead.
Okay. So explain that. You've been treating long haul COVID for 22 years because coronavirus or these situations.
Well, So this is
these
not
symptoms.
The symptoms of quote not long haul COVID that are now being that everybody's familiar with. These are all the same symptoms of all the mystery illnesses that I had and that I've been treating now for all these years. So again, the chronic fatigue, the fibromyalgia, which in Europe they call it much better. It's called myalgic encephalitis. Again, these weird neuropathies, these weird neurological symptoms, these weird hormonal things, weird autoimmune
psychiatric.
Oh my God, just don't even get me started on the psychiatric. It's a particular passion of mine. They're being triggered because it's the body's immune system response. So the idea that COVID was a virus that caused pneumonia, that's not true. It's actually the spike protein, and it doesn't matter where that spike protein came from, whether or not you got it from originally getting sick, or if you came from the solution to being, to theoretically that was supposed to prevent it, which it did not. It didn't prevent it. It didn't prevent you from getting it. It didn't prevent you from transmitting it. And maybe it prevented a few people from being hospitalized, but everybody else who's been hospitalized now got that particular treatment. And it's the level of the spike protein it's our immune system's response to the spike protein that is creating all the problems that we're seeing. And when that spike protein is now, which is theoretically, it was supposed to not stay in the body, but it's being found in the ovaries, in the testes, in the brain, in the heart muscle. We're seeing all kinds of issues with it. And in women in particular, the abnormal bleeding. So I've had so many postmenopausal women, they've been on, little low dose hormonal replacement therapy. We've been rocking along for a number of years, did fine, all of a sudden start bleeding out of nowhere. Mm-hmm. The miscarriage rates, the infertility, that we're seeing, the pelvic pain issues, the heavy bleeding and the blood clots. And the blood clotting issues, I'm not just talking about uterine, I'm just talking about strokes and cardiac issues have been unbelievable. And not just in women and men too. And I won't talk a whole lot of men. In the young men, we're seeing all the myocarditis and again, strokes. And
let me emphasize that, for my audience, Dr. Margaret Christensen and her team at Carpathia Collaborative in Dallas, they see and for decades now, the mystery illnesses, right? These are the complicated patients. They've been to, at least 10 or more physicians at this point down multiple pathways, and they get their problem solved here. So she is the creme de la creme, in working in this area, teasing out what's the issue, how do we cleanse from it, how do we support your body to start working the way it's supposed to be. And I just want to emphasize, it is not your, walk-in clinic type situation here. I mean, this is where people come because they've gone everywhere.
Yeah. And we also do, we also do a lot of, healthy wellness and longevity and that piece. I just, what's interesting is when you
That's my fun part.
Yeah. When you come in for that and you're wanting that, and you're wanting long-term well-being, but you have, a strong family history of cardiovascular disease or dementia, or cancers, whatever, and you want to live a long, healthy life and do all the best things, then part of what we're doing is identifying how full is your toxic bucket. And because that's what's going to disrupt, your hormones and your immune system and your nervous system. So, and a lot of things I'm speaking about personally, I've personally happened in my family, regarding in those last 3 years.
You mean post-vaccine exacerbation of symptoms?
Severe neuropsychiatric issues, severe psychosis requiring hospitalizations, atrial fibrillation requiring pacemakers.
Young adults.
Young adults. My scribe's 19-year-old grandson who had a hemorrhagic stroke, and had brain surgery, and he's still paralyzed on his right side. So, and the gut issues. Oh my gosh, the gut issues that we're seeing is just been unbelievable. And then what does gut influence? Your hormones. So, and the good news is that there's all kinds of things that we can do to help counteract that and counterbalance. And that's a whole nother, that's an entire summit in and of itself. But there's a lot of things that we can do to help our bodies, put back what's missing. So what are you missing? Are you missing certain nutrients, vitamin D, A, C, E, B complex? Probably everybody needs to be on a methylated B complex, in my opinion, these days. Are you missing sleep? Are you missing laughter and joy in your life, purpose and meaning? Those are all things that are incredibly important to ask yourself. And then what's toxic and no longer serving you, besides the things that I've talked about, the pesticides and the petrochemicals and the molds and the heavy metals and excess spike proteins. What about toxic relationships? What about a toxic work environment? Those are the things that we're asking questions about to help heal.
Yeah, no. And so
when I'm looking at toxins, it's much more than just, just this.
There's a lot of toxins, So say for these long haul COVID symptoms, what are some standards thinking about, okay, you've got long haul, we want to get you on some N-acetylcysteine, some glutathione, if you can do an NAD. I mean, what are some of those recommendations to that people are dealing with this and okay, let me get started on something.
I think that, again, the first things that as in functional medicine, the first thing we always start with is the gastrointestinal tract, because there's 80% of your neurotransmitters, 80% of your immune system function is in your gut, and all your hormones are balanced there. So if you have bad gut issues, again, you're having gas, bloating, SIBO issues, you're constipated, or you're
irritable bowel diarrhea,
all of that right there, that's one of the first things that we look at. And how do we address that? You start out with an autoimmune paleo diet, usually, or some type of low inflammatory diet.
It's my keto-green diet in my world.
Right. Yeah. And for most people, and then we use specific nutrients that help with kind of gut repair. And of course you can do testing to see how bad are your bacteria. But I would just say for everybody, just trying to eat as organic as possible, no processed foods, and all the things that you tell them, and lots of vegetables. Again, vegetables are, it depends which they are and what issues you've got. If you got a lot of immunity things, then you got to be, there's certain things that you want to avoid initially, and then you can put them back in. But I just say get off of grains, in particular corn and wheat. All the corn in this country is genetically modified, and it's very pro-inflammatory. And so Those are some of the simple things I do with that. And then there's so there's gut issues, and there's immune system dysregulation that's gone on with a lot of long haul COVID. Again, being on an autoimmune paleo diet, right there, that helps to decrease the signals to your immune system for inflammation. But then we can use things like you mentioned, NAC, quercetin. We can use antihistamines, both over the counter as well as prescription ones, as well as we use a wonderful one that's called Immunothrive that was developed by another colleague of mine, Gail, that has lots of different things in it, pycnogenol and quercetin and a few other things. So you want to cool down the immune system. You want to get your gut moving really well. And then what we're seeing is a lot of vascular issues. So really what COVID is not a pneumonia. It's an intravascular vasculitis. It's an inflammation in the blood vessels themselves. And when those blood vessels are in your lungs, and they're little tiny capillaries, the little tiny blood vessels, and they get all backed up, and your hemoglobin starts unloading its iron and dumping iron into your lungs, and this ground glass appearance, it looks like a pneumonia, but it's not. It's an autoimmune inflammation. You can look at the protocols at Frontline Critical Care, COVID-19criticalcare.org. They have a lot of protocols that can then, depending on your particular area, but you support the gut, you turn down the amount of inflammation, and primarily you can do that with diet, and then there's lots of nutrients, like you mentioned. NAC is a big one that we use, and glutathione. Vitamin D is critical, very important. Vitamin E tocotrienols, that form, not the other forms, but
not the alpha tocopherol, but the tocotrienols.
Tocotrienols, yeah. So we'll use that a lot. And then you have a mitochondrial problem. So the mitochondria.
Let's talk about mitochondria. Mitochondria, the energy powerhouse of our cells. It is important for energy. It makes the abundance, our abundance of our ATP, our energy molecules, and it's so critically important. So resuscitating mitochondria.
Yes, yeah, that's a huge piece. And like you said, mitochondria are what produce the energy. They take what we consume, the foods that we consume, whether they're fats or proteins or carbohydrates, and they break them down into glucose on the carbohydrates, glucose and sucrose, and the proteins get broken down to amino acids, and the fats get broken down into fatty acids. And the mitochondria use those things, and they break them apart, and out of that they generate energy. Well, if your mitochondria are toxic for all the same reasons that we just talked about. And probably one of the things I didn't say is that a lot of the persistent organic pollutants, or the persistent environmental toxicants, including the pesticides and toxic mold and heavy metals and petrochemicals, they're fat soluble. They're little tiny. They're called biotoxins. They're fat soluble toxins, and so they get inside our cell membranes and inside our mitochondrial membranes, and they disrupt the function of the cell itself. So and then with the mitochondria, they start breaking down. And when the mitochondria break down, because they've got toxicants in it, including lots of use of antibiotics, are toxic to mitochondria. The mitochondria break down, and when they do that, they spill out all their contents, and then they trigger an autoimmune response. But if your mitochondria aren't working, then you have a lot of fatigue. And then where do you have the most mitochondria? Well, in all your neurons have thousands of mitochondria in your brain because they're on 24/7. They never stop. So they're on all the time, as is your heart. So the things that we're seeing with long haul COVID and post and I'll just call it spike protein incidents often have to do with the nervous system and the heart. And because we're disrupting mitochondrial function. So anything that we can do to support the mitochondria is helpful. Now, I use a lot of phosphatidylcholine, specific forms of it that helps that's part of our detoxing process that helps the mitochondria. And we can use things like methylene blue can be super helpful. It's real interesting that hydroxychloroquine and ivermectin were, just, peed over all over, and, you're giving people horse paste and blah, blah, blah. ivermectin works because it actually decreases what's called a Th17 response of the immune system. It helps to shut down the immune system's response to what's happening with the spike protein. And it's actually our own immune system responding to the spike protein, which is creating all the health issues. And so how do we manage and modulate? And low dose naltrexone is another one that we use a lot. We use a lot of methylene blue. We'll use hydroxychloroquine and or ivermectin. So those are some of the things that can be helpful. And then we're supporting. So if you've been under massive amounts of stress because you had to quit your job or stay home, or you've been cooped up in your small apartment with your children for 2 years, and you're going crazy. We need to do something that helps to manage and modulate those stress hormones. Because they're triggering all kinds of it just perpetuates the dysfunction.
Right. For me, I add in the adaptogenic support of the Mighty Maca Plus, progesterone, DHEA, like that little bit of hormonal support too. But I love what you're saying, and I love how you're approaching it too, because it's not a one size fits all approach, but getting down to, when it comes down to it, and this is what root cause medicine is, getting down to the smallest change that we can make to get the biggest result happens at the cell, happens within the cell, right? The cell membranes. It's not putting a Band-Aid on. It's not putting a patch on. It's not. It's really getting to healing those broken pieces. And I always give the visual example of you spent all your spring tending to your garden, right? And you've got this nice fence up and to keep all the little rabbits and rodents and deer out from eating your beautiful vegetables and fruits. And all of a sudden a storm comes in or whatever and breaks down the gates to the garden. And now all these, invaders are coming in and eating your beautiful garden, and it starts to fall apart. I mean, that's exactly what's happening at the cell level. The cell membrane would be the gate. The cell contents is your garden, your fruits and vegetables growing in your garden. And so healing, internally and healing and you've got to fix that boundary. You've got to fix that healthy boundary border to the cells.
Well, that's a great analogy. And let me just pick up on the boundaries thread. Boundaries include emotional ones, emotional, psychological, spiritual ones. And again, if you are living with an active alcoholic or addict, or again, somebody who's having a lot of psychological issues, learning how to set clear boundaries around what.
Oh my gosh, Margaret, you're gonna totally have to help me on that, because that's why I burn out from practice in the first time. PTSD, no boundaries, workaholism, 3 hours of sleep a night. So now I'm like tiptoeing back into your clinic and thinking, okay, help me with my boundaries, my friend, help me with my boundaries.
Yeah. Well, I think we all, it's a continuous process, and we have to repair them all the time. So there is a great book called Boundaries.
Read it.
There's 2 of them that are out there on boundaries that are great.
By Dr. Cloud.
Yeah, and I highly recommend also any Melody Beatty's work. She wrote Codependent No More and Beyond Codependency, and I use her daily reader that, again, I've used probably for 25 years. It's called The Language of Letting Go, and it's one of the top things that I recommend for folks. So, while you're having all these hormonal, problems or dysfunctions, or you're having chronic illnesses of some sort, or you're having, really severe distress, depression, anxiety, sleep disturbances, bipolar issues, while you're working on those, you have to also really bring in, every day, a little bit of joy, a little gratitude, or what's right in your life. What's right about me? And that's really the whole coaching model. I'm also a certified functional medicine health coach. And again, in medicine, we're taught to look at people like, what's wrong with you? Instead of, well, what's right about you, and how do we expand that? Boundaries is one of them.
Now, give us an example of a patient that came in with severe long haul COVID symptoms, and what, what happened, like how you were able to help that patient.
Again, we'll have people coming in here with a really severe brain fog and fibromyalgia issues. And I think a big piece is getting a good history. What are there, from a functional medicine standpoint, we call these antecedents. What are your antecedents? What are the things in your past that make you more susceptible? So what's gone on in your family? Do you have, again, addiction in your family, or alcoholism, or cancer histories, or dementia histories? So right there, that tells me something about your detoxing pathways. And what were your exposures growing up? Again, any traumas that happened, what kind of food did you eat when you were growing up? So we're getting a really extensive history. One of the most important questions I ask, how many antibiotics have you been on in a lifetime? And that is a revealing question. And again, antibiotics are major hormonal disruptors. People have no idea. You increase your risk for breast cancer with that if you've been, on years of antibiotics. How much alcohol do you drink? That's another big thing. That's a huge area in women. And women can very easily slip into, and we call it alcohol use disorder now. And very easily, and it's a progressive disease. So these are all underlying things. So we're getting a really decent history on you, and then we're going to get some blood work on you to figure out, okay, just some basics. How's your electrolytes and your blood count, and are you anemic or not? Oh my gosh, one of the things I didn't talk about with again the whole COVID issue is the level of bizarre iron levels, and both anemia as well as hyperenemia.
Hyper iron
levels.
Yeah,
having too much iron, really high ferritin levels, and that ferritin is one of the markers that we get all the time. So we have a nice panel that we're getting of inflammation markers, as well as hormone markers, as well as antibody markers, for example, against your thyroid. I didn't mention thyroid much in there, but again, cortisol, estrogen, progesterone markedly impact your thyroid, and thyroid hormone works because it tells your mitochondria to make energy. So if you may have perfectly normal thyroid function-ish, but your mitochondria are sick, and so your signal to the mitochondria to make more energy is not working. And the answer is not to give more thyroid hormone; it's to detox the mitochondria. So so those are the kind of things that we're doing. A lot of times, again, we're seeing pretty complex people in this particular arena, and oftentimes it takes a good year, because we're starting with gut health. First fix up your gut, and we're also starting with limbic system dysfunction. I mean, if you're super stressed out and you're hyperreactive to everything, and know that we need to calm down your whole nervous system and calm down your gut and get you sleeping. We need to get you pooping and sleeping, those two things first. And then we can start layering in all the other things. So we clean up somebody's diet. We identify what nutrients they may be deficient in and put those in. And then once we have their immune system stabilized, so it's not overreactive, because we're seeing massive amounts of autoimmunity. Oh my God. Wow. And I first started seeing that one after the Gardasil vaccine. That's a big no-no. We're GYNs. There is no need for it. There is no need for it at all.
Thank you for saying that.
We do pap smears. We do pap smears, and that's for cervical cancer. You don't need, the BS that we're being fed. Oh my God. Don't.
And we don't stop doing pap smears. Even post-menopausal, periodically every 3 to 5 years, get a pap smear, especially if you're sexually active. Do it. If your insurance won't pay for it, it's like under $50. Do it yourself. Pay for it yourself. It's the best investment. But you have to be diagnosed with vaginal cancer or cervical cancer post-menopause. It's a crime. It's unnecessary. And if it's because it's due to lack of pelvic exams and pap smears, because our college, American College of OBGYN, says it's not the cost benefit analysis doesn't warrant it. However, insurances will cover Viagra in 18-year-old men. So let's talk about cost benefit analysis.
Yeah, well,
I started, Margaret. You got me on a high road.
Yeah, the two of us, we're gonna, but and again, kind of to your point, getting the Gardasil is not going to prevent that stuff. Sorry, I didn't mean to say it out loud, the name of it. Anyway, so but the one of the whole challenges with that, and I would highly recommend this website called learntherisk.org.
Learntherisk.org.
This is how many vaccines I got when by the time I was 18. It's now 77 doses.
And
Yeah, because they added the COVID vaccine. So the drug companies can't be sued for all the side
Yeah,
effects.
we need to change that law. That
That's
law
a whole
needs to
nother
be
discussion.
changed.
That's
A whole nother
discussion.
discussion.
But
But
that's
I
a whole
keep
nother.
wondering why America doesn't stand up and say, change that law, make the drug companies responsible. It's obviously not keeping us from a public health
Well,
crisis at this time.
because the drug companies put all the politicians in office,
Yeah.
particularly at the national level. So
On that happy note, Margaret, we'll end on a positive note that I know
okay, we'll
I've
change
seen.
that. Yeah. Okay.
I've seen you change patients' lives, change people's lives, and I've been in your office for IV vitamin therapies, and just to, keep that boost, keep me strong and healthy,
Yeah.
and I think it's just an important part of especially when you are dealing with a lot of stress and a lot of unrest, and but certainly if you're not feeling your best, it's like, okay, well, what's the next right step for you? And I think looking at the toxins, like you said, how full is your toxic bucket? And you've got to cleanse it. It's like every time the season changes, do a detox. I have my keto-green detox. There are other detoxes, but anyway, the ones that support liver detox supports gut health. If you're having constipation, diarrhea, irritable bowel syndrome symptoms, that is, it has to be addressed. If you're not sleeping, we have to address that. And if you're looking at the negative and not the positive, like looking for the best case scenario, we have to change that too, because where our attention goes, our body will follow. So we have to make these changes, and there is hope. You've seen some of the worst cases get complete turnarounds and reclaim the vitality in their lives. And so it's important to create safe community around that. Tell our audience, and you guys, just a little side note, mid of August, I'll be seeing some patients, clinical consultations there. Margaret, tell everyone where where to reach your website and phone number.
Yeah, sure. CarpathiaCollaborative.com. Carpathia was the ship that picked up the survivors of the Titanic. So we have the Titanic of Western medicine treating the tip of the iceberg without looking at, what's underneath the surface. So that's how we got the name. So Carpathia, CARPATHIA, and the word collaborative.com. And also molddetoxdiet.com. There's if you already know that might be an issue for you, although really from a standpoint of any type of environmental toxicity, we have a simple dietary plan and nutrients and stuff that can take you through that. And there's also the advanced immune modules that can be done if you're a practitioner, that you can access through that, and that gets into the nitty-gritty really how to do this work. So yeah.
That is awesome. You're always teaching, and I appreciate you. I thank you for being on the Girlfriend Doctor Show. And I think,
absolutely, yeah,
we'll always see you
next time. That's fun.
Oh, absolutely. We will talk more, and definitely want to encourage all of you listeners to put in your questions, like write in your questions. We talked about a lot of stuff, and it would not without controversy. Don't report me to the FDA or anything like that, or CDC. Please don't report me, or our conversation. But really help spread the word. I mean, we're educated physicians. Some of the highest educated physicians are. Observation is key here. And so what are you seeing? What are you feeling? First of all, we know it's not in your head. We have to get to the root cause of it, and that you're not broken. There's every lesson that we learn in our life is towards a greater purpose. So I love the phrase in the verse in the Bible that says all things work for good for those who love him. It says all things work for good, not all things are good for those who love him, but all things work for good for those who love him. That means you're looking for a higher purpose. You're looking to know that there's a higher connection, there's a higher calling, and you have many purposes in your life. So I encourage you, you deserve to be happy. You are worthy, and joy is your birthright. So I love you being here with me. Thank you for being part of the Girlfriend Doctor community. Till next time.